We all do it. Poop. It might not be the most glamorous topic, but paying attention to your bowel movements, especially the color, can offer valuable insights into your health. Just like a car's dashboard warning lights, changes in stool color can signal that something might be off kilter in your body. Think of your digestive system as a complex machine, breaking down food and absorbing nutrients. The color of your stool is largely influenced by bile, a fluid produced by your liver that helps with digestion. As bile travels through your intestines, it undergoes chemical changes, resulting in the characteristic brown hue of your stool. However, certain foods, medications, or underlying medical conditions can alter the color of bile and, consequently, the color of your stool. While most variations are harmless and temporary, some color changes can indicate a more serious health issue that requires medical attention. By understanding what different stool colors mean, you can become more aware of your body's signals and take appropriate action when needed. Remember, knowledge is power, and being informed about your health can give you peace of mind. Let's face it, discussing poop isn't exactly dinner table conversation. But when it comes to your health, it's important to be aware of what's considered normal. In general, a healthy stool color ranges from light brown to dark brown. This variation is entirely normal and can be influenced by factors like diet and the speed of digestion. For instance, if you've been loading up on leafy greens like spinach or kale, you might notice your stool taking on a slightly greener hue. Don't fret, this is usually harmless and simply reflects the presence of chlorophyll, the pigment that gives plants their green color. Similarly, consuming beets can temporarily turn your stool a reddish color, while certain medications like iron supplements can lead to black stools. These dietary and medication-related color changes are typically temporary and should resolve on their own once the triggering food or medication is discontinued. However, if you notice any drastic or persistent changes in your stool color, especially if accompanied by other symptoms like abdominal pain, blood in your stool, or changes in bowel habits, it's essential to consult your doctor to rule out any underlying medical conditions. While variations in brown are generally normal, black or red stools warrant closer attention. Black stools can indicate bleeding in the upper digestive tract. Red stools usually indicate bleeding in the lower digestive tract. Not all black or red stools are serious. Diet can affect stool color. Persistent or unexplained black or red stools with other symptoms need medical attention. While dark stools can indicate bleeding in the digestive tract, pale or clay-colored stools can signal a different set of issues. This pale coloration suggests a lack of bile in your stool, which could be a sign of a problem with your liver, gallbladder, or pancreas. Bile, a digestive fluid produced by your liver, plays a crucial role in breaking down fats and gives stool its characteristic brown color. If your liver is not producing enough bile, or if there's a blockage preventing bile from reaching your intestines, your stool may appear pale or clay-colored. Conditions that can lead to pale stools include hepatitis, cirrhosis, gallstones, and pancreatic cancer. These conditions often present with other symptoms like jaundice, yellowing of the skin and eyes, abdominal pain, nausea, vomiting, and weight loss. If you notice your stools becoming consistently pale or clay-colored, especially if accompanied by any of the above symptoms, it's essential to consult your doctor promptly. Early detection and treatment of underlying liver, gallbladder, or pancreatic issues are crucial for improving outcomes and preventing complications. Section 5. Food dyes and medications. The unusual suspects. Our digestive system processes various substances, from food to medications. These can sometimes change the color of our stool. Food dyes in candies, frosting, and sports drinks can stain your stool. These changes are usually harmless, but highlight the importance of reading labels. Medications can also alter stool color. Iron supplements can turn stool black or dark green. Pepto-Bismol can cause black stools. Certain antibiotics can lighten stool or give it a greenish tinge. Always check with your doctor or pharmacist if unsure. Section 6. When to worry. Signs you shouldn't ignore. Some changes in stool color can indicate serious conditions. Seek medical attention if you experience the following: persistent black or red stools, especially with abdominal pain or dizziness. Pale stools could indicate liver or gallbladder issues. Sudden diarrhea or constipation lasting more than a few days. Always consult your doctor if you have health concerns. Section 7. Your gut feeling. Trusting your instincts. We often hear the phrase, trust your gut, and when it comes to your health, this advice holds true. You know your body better than anyone else, and if something doesn't feel right, it's important to listen to those instincts. Don't be afraid to advocate for yourself and seek medical attention if you're experiencing persistent or concerning changes in your bowel habits or stool color. While it can be uncomfortable to discuss these topics, remember that healthcare professionals are there to help you and want to ensure you're feeling your best. Early detection and treatment of any underlying conditions are crucial for improving outcomes and preventing complications. By trusting your gut and seeking timely medical advice, you're taking proactive steps towards safeguarding your health. Section 8. Seeking help. Talking to your doctor. We've covered a lot of ground about stool color, and you might be wondering, when should I actually pick up the phone and call my doctor? It's a great question, and here's the simple answer. If you're concerned, reach out. Doctors are used to discussing all aspects of health, and that includes bowel movements. Don't be embarrassed or afraid to bring up changes in your stool color, especially if they are persistent, accompanied by other symptoms, or causing you anxiety. When you talk to your doctor, be prepared to describe the color of your stool as accurately as possible. Mention any other symptoms you've noticed, even if they seem unrelated. Be honest about your diet, any medications you're taking, including over-the-counter drugs and supplements, and any recent travel. Your doctor may recommend a stool test, blood work, or other diagnostic procedures to help determine the cause of your symptoms. Remember, they are on your team, and open communication is key to getting the right care. Section 9. Peace of mind. Knowledge is power. As we've explored, the color of your stool can offer valuable insights into your overall health. While most variations in color are harmless and temporary, some changes can signal an underlying medical condition that requires attention. By understanding the potential causes of different stool colors, you're empowered to take control of your health and seek medical advice when needed. Remember, knowledge is power, and being informed about your body can help you make the best decisions for your well-being. If you're ever in doubt, don't hesitate to reach out to your healthcare provider. They are your partners in health and can provide personalized guidance based on your individual circumstances. Take care of yourself, and remember, a healthy gut is a happy gut. 对呀。